Welcome back to OpenLine. We are talking about health care in Tennessee. The vote in Congress last week didn't go anywhere. Affordable Care Act was not repealed. It is still the law of the land. So what does that mean? And that's what we are discussing tonight. It's the law of the land. Mm-hmm. No major changes in Tennessee. You all, though, take calls every day. Mm-hmm. What do you see good and bad? I mean, what are some encouraging calls? What are some heartbreaking calls? And I'll start with you. You know, kind of what do you see?
Yeah, the heartbreaking calls for me are those that are recently released from incarceration. And when they're incarcerated, they can go to the infirmary, they can get any kind of service they need done, performed, and the state is paying for it. But once they are released, then they have 60 days to get insurance. Without having a job, without having any money, any income, any children that they live with, they're in the gap. So they come out, and a lot of them come out with health issues that they've been dealing with while they were incarcerated, and they were getting the treatment for it there, but when they come out, they can no longer get treated for whatever that was because they don't have any insurance, and they can't get it because we didn't expand Medicaid. And had we expanded Medicaid, then those childless adults with no income could continue to get the services, preventive, maybe, you know, check their diabetes or, you know, whatever they may be dealing with, they may have been dealing with on the inside, they can still continue to get services. But without that expansion of Medicaid, they're just kind of out there without any help. And that's heartbreaking to me.
Right.
Because
and there are a lot of people like that, right?
There are a lot of people like that. When they come out of jail, it's hard to, it takes a long time to find a job. And a lot of the ones you may find will not offer insurance because it may be a temporary or short term, and unless you are able to find something that's going to put you in the category of income that would afford you some tax credits, you're not going to get any help on the Affordable Care Act. And if you don't have any children, you're not going to get the TennCare. So you're just kind of really stuck out there, a lot of times ill, because you can't get any coverage. And that's really heartbreaking to me. What
are some of the things you see?
I think one that really sticks out was a few months ago. This was actually before the last open enrollment period, so it wasn't open enrollment. Got a call from a gentleman who had just found out that he'd just been diagnosed with lung cancer. And unfortunately, he worked in like a very, I think he was a construction worker. It was a very manual, you know, type of job, really hard on him. And he had to cut down on his hours so much that he was no longer eligible for his employer insurance. So, you know, you find out that you have this disease and you're trying to get treatment for it, and then you lose your insurance. So, you know, in cases like that, he was able to get a special enrollment period and able to get a really affordable plan on the marketplace and be able to get that cancer treatment that he needed, you know.
So that's good. That's the pre-existing condition that we're talking about. Because before, nobody's going to take somebody that has been diagnosed with lung cancer. But now they had to take him now. So that's a positive thing.
Right. That's good.
Okay.
I like that story.
All right, let's go to Bob. Hello, Bob.
Oh, hello. It's a good program. One of the problems, we've got such an influx of people coming in the state. The metro services just can't cover it, you know. And the mental health program is not covered, you know. Physical health is mental health. You know, you got stress, and you got drugs and trafficking, and you know, people coming in and do what they want to and bother the heck out of everybody here or something now. But it gets to be a problem. And you know, if they could expand Medicaid by covering mental health, you know, people have a right to complain about being disturbed without having to go to firearms or this, that, or the other thing.
All right, well, let's talk about that. Bob, I really appreciate the call. Talking about mental health. What is out there? What are the programs?
So mental health is covered by Medicaid. And it's also one of the 10 essential health benefits. So every plan sold on the marketplace covers mental health. I think a big part of the problem is if you can't get the insurance, then you don't have the mental health coverage. So like those folks that are in the gap,
they can't get it.
So that might be that's a big problem.
Is it also part of the problem that deductible's so high? For some people, it's just really hard. I mean, we were talking about huge deductibles. I mean, we have that where I work. I mean, just huge deductibles, and it makes it very difficult on a lot of people, right?
Yeah,
so you have insurance, but it's really catastrophic care. If you get something, you're not going to have to sell your house, but you're thousands of dollars in the hole often before the insurance kicks in. And is that a problem?
It depends on what type of plan you choose when you sign up. If you qualify for the subsidies and you sign up for a silver plan, they do subsidize your deductible as well. If you qualify for that. If you don't, then yes, certainly. A lot of people are going for the higher deductible plans because they have a lower monthly premium. So although mental health is one of those 10 essential health benefits, it's not one of the free preventive services. So there is going to be a copay or you're paying out of pocket until you reach that deductible. So.
And Bob mentioned the people moving into the state. How does that impact us? How does that impact healthcare in Tennessee, if at all? Just the tons of people moving in.
Well, if they're eligible for Medicaid, then we're having more people getting Medicaid services, and that's increasing the enrollment there and the money that's cost to cover them.
So that could be a drain. That could be difficult.
I don't want to call it a drain, no. It's a great service that they are afforded when they come here, but when the more people you're covering.
Are you seeing people move, because we have not expanded Medicaid, are you seeing people move to states that have expanded Medicaid? Is there any data that would indicate that actually happens?
I don't know. I don't know. I mean, it's something that, we kind of halfway joked about a little bit in the first open enrollment period because Kentucky expanded Medicaid, and especially if we would get callers who were really close to the border, but really it was more just to illustrate that in two different states that are side by side, sharing a region, there could be like dramatically different programs available to you. So we're all paying federal taxes, right? Whether you live in Tennessee or you live in Kentucky. But if you live in Kentucky, you might qualify for this extra program.
It's a huge difference. Just that. That is interesting. We talked about essential health benefits. You have a list there.
I do.
And tell us what we're talking about there.
So the essential health benefit coverages are ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, prescription drug coverage, rehab and habilitative services, lab work, preventive wellness services, and pediatric services. Those are the 10 essential health benefits that every insurance policy must cover.
So they are all covered. And then, all right, so we have 3 minutes left in this segment. We'll put up your number in the next segment. But, what do you want people to know? There's been so much debate out there. What do you want people to know where things stand right now?
Right now, everything's the same. We really want people to take advantage of the special enrollment periods because there has been some studies showing that they aren't really utilized that much, and there's probably a lot more people who are eligible for them and don't take advantage of them. And of course, getting healthier people into the risk pool, getting more people into the risk pool is always going to lower costs. So ultimately, we would just like to get the word out about the special enrollment periods. If anything changes, if you lose your insurance, please reach out and try to see what your options are on the marketplace. Even if you think you're going to get a job really soon, hopefully you will, but just for those few months where you don't have any coverage, something catastrophic could still happen. So, we just want everybody who thinks they might be eligible, or even if you think you aren't, to reach out and find out.
I like that answer better on the people moving to Tennessee in droves. We're getting more healthy young people into our risk pool. That's what's good about people moving.
There we go.
All right. There you go. And all right. Well, I think that is interesting. And this ongoing debate, you want people just to take advantage of these enrollment periods. But no, it's still going. There is no change in the foreseeable future right now. and we'll just kind of see if it's, if it's reformed or whatever. All right, we're going to take a break. Then we're going to come back. We'll put up your phone number and go from there. We'll take a break. Be back right after this.